Exosomes. Maybe people are hearing about this. What are exosomes?
Exosomes are simply your body's communication systems. It was a big discovery. We used to think everything was about stem cells, and we realized that it's actually these exosomes.
What's it doing when it's on the skin?
In our studies, we've seen improvement in the appearance of brown spots, improvement in luminosity of the skin.
How much do I need to get the benefits?
Skincare really benefits from consistency. This isn't something you want to do once a week. It really should be a part of your daily ritual.
Like biggest waste of people's time and money when it comes to the beauty world.
You know, I think a lot of these...
Alyssa, welcome to the podcast.
Thank you for having me.
So let's get right into it. I would love to know how we're going to talk a lot about exosomes as it relates to our skin and just body as a whole. I want people to get kind of a practical guide on this and more. But how did you get into this space? What precipitated your fascination with the world of exosomes as it relates to skin health?
Yeah, great question. I've been in actually medical for a while, in medical aesthetics for over 10 years. And, I think I was always really excited about this idea of regenerative medicine and this idea of regenerative beauty and how do you merge this biotech with beauty. And so I had an amazing opportunity to fly up and meet this team at Mayo Clinic and really got excited about the science that was too good to really stay in the lab and wanted to bring it to the beauty space.
Amazing. Okay, so exosomes. Maybe people are hearing about this within the world of longevity and regenerative medicine, and certainly if they listen to the podcast, we've talked about it. But for people that don't know, let's start with just defining what are exosomes.
Yeah. Exosomes are simply your body's communication system. So you have thousands of exosomes in your body that are sending different signals, whether it's renewal, regeneration, inflammation, all kinds of different things. It's how your body communicates. And it was a big discovery. We used to think everything was about stem cells, and we realized that it's actually these exosomes that play a really critical role within our body.
Got it. And can you kind of get into the weeds of the fact that our body makes these, but they decline as we age, and on top of that, maybe decline even more precipitously because of modernity and all its, problems, right? Environmentally.
Yeah, I mean, we put a lot of stress on our body. And you're right, as we age, our exosomes decline, especially regenerative exosomes. And that's why, when you're young and your child falls, they cut themselves. And like a day later, you're like, oh, the cut is gone. And then you do the same thing to yourself and you're still putting the Band-Aid on several days later. And that's just part of aging. And that's why PRP we also see isn't always consistent. Because people are trying to, as they're older, get these regenerative exosomes from their PRP, but it's actually, they needed them when they were younger.
Got it. Yeah. So could you explain that for people that don't know about PRP? Because it is kind of more, I don't want to say conventional. It's a therapeutic procedure that can be done that has some benefits, right? But has some limitations as well, right?
Yeah, so it's done by basically drawing your own blood in an office, and the problem is the data would suggest it's very inconsistent. Only about 5 to 10% of the people get these incredible results, and most people don't really even see good results because it's inconsistent. Like if you didn't sleep well, or you didn't eat well, or you're very stressed, you're not going to have consistent exosomes in your PRP, so you're not getting that benefit the same every time. And that's why we really needed something that was more consistent.
Yeah. So you kind of were deep in the research around regenerative medicine and stumbled upon exosomes and the emerging science around them and how stem cells, really a lot of the benefits actually come from exosomes. How did that translate from just regenerative medicine as a whole to skincare specifically? What was that leap?
It was actually an accident. So our technology started out in the Van Cleve cardiac regenerative medicine program in Rochester, Minnesota, at Mayo Clinic. And they were doing studies for cardiac patients. So both of our physician scientist founders are cardiologists. One really focuses on heart transplant, and the other is very internationally recognized in stem cells and regenerative medicine. So they were really trying to democratize regenerative medicine. And so as they were in the lab and kind of working on with these platelet-derived exosomes, if people who've worked in labs before and they wear these gloves, sometimes your hands get irritated from having these gloves on all day. And they were starting to put this platelet extract on their hands, and they started realizing, wow, my hands are looking, my skin is looking better. And so they said, maybe we should try to do something in skincare. Vandy Cream is actually another technology that's come out of the Mayo Clinic. And so they partnered with one of the former formulators there and started working on formulations to use this unique human platelet extract in skincare and beauty.
Wow. Okay. So you hear about different types of stem cells, and basically every cell can make these exosomes specifically. So how the doctors, the researchers at the Mayo Clinic stumbled upon this, and you mentioned it being human-derived. Like, how are these extracted, these specific exosomes that you're talking about as it relates to skin health? How are they extracted and formulated?
Yeah, there's all kinds of ways to get exosomes. You probably have exosomes on your hand right now, but the key is getting them at a high enough level and getting the right ones. Because as we talked about before, you have lots of exosomes. You certainly don't want
Yeah.
one that's, talking about communicating inflammation, right? And
Yeah.
so
Right.
after looking at lots of sources, and people can use umbilical cords and MSCs and all kinds of different areas to get these, our founders actually have proprietary patented technology around platelets. And if you think about it,
Got it.
go back to that wound that we talked about when you cut yourself. What is the first responder to that cut, right? It's your platelets. So they have a unique ability to renew your skin. And what we really liked about the platelets was that they have no cell nucleus. So there's no DNA. So you are literally just getting this exosome. You're not getting anything else. Whereas if you're getting from umbilical cords or some of these other sources, you're culturing cells in a lab and then manipulating them again and again. And we're not doing that. And that's what makes this technology so absolutely different and really breakthrough.
Amazing. So are they synthesizing? Would that be an accurate term? The synthesizing platelets, exosomes from platelets, forgive my ignorance in the
Yeah.
skincare world, but I'm trying to understand that. Of course, it's proprietary, so I'll respect that. But I'm saying overall, is that how you would describe it? Sort of synthesizing of platelet exosomes.
Yes, so we use the word they condition the platelets to produce the exosomes in a
Got
natural
it.
way. So we're not manipulating them. Again, when you're doing cell cultures and you're getting two consenting adults and building this line from two consenting adults, you're doing a lot of manipulation in the lab, and it's very, very expensive. And those kinds of things, you can't get what you need in something like a skincare because it's so expensive. And so that's what the beauty of this is. We can produce pentillions. I didn't even know what that was. Like 10 to the 18th with these platelets. So we don't need lots of platelets to produce, really high quantities of these, renewing exosomes.
Amazing. Okay, so you're talking about this sort of really significant number. I mean, another thought that came to my mind was the sustainability of this as a company, right? Is it hard to produce? I know sometimes the active ingredients can be difficult sometimes, right? It could be hard to mass produce, but you guys have solved that for people to, as you said, democratize exosomes.
Yeah. And the nice thing about our technology is we're actually purchasing them when they're ready to expire, right before they expire. So we're not taking anything out of the system. We're actually giving these centers money to take these
Yes.
platelets and then ship them to Rochester, Minnesota, and run our production. So it's an amazing thing of, you know, doing something that's helping the whole chain. And like I said,
Yes.
we don't
Right.
need to take away so much because it's just a very efficient process.
Amazing. Well, that's really interesting to find that out, because these things would be thrown out anyways, but they're being able to be utilized in a whole different industry, not just the medical world, but the skincare world.
Yeah, and people can feel good, right? They're giving the donation and it's not just getting thrown out if it wasn't used. Like now it has another use, and a wonderful use because not only, we have technologies in different business units. So it's a lot of different areas that they're using these now.
Got it. And then you mentioned exosomes, like they're not all the same. You don't want something that's mediated, communicating inflammation when you're talking about skin cells, right, and skin health. But these platelet exosomes are communicating what exactly? Like what's the sort of these repair mechanisms? What's it doing when it's on the skin?
Yeah, so I mean, I think it's just a simple message of renewal. They're very strong in terms of antioxidant, so probably 10 times more stronger than vitamin C. They work in a different way, so they could be synergistic. So don't throw away your vitamin C if you love it, but certainly something that's very powerful. And they're really, helping. It's like a smart technology, right? We in our studies we've seen, improvement in the appearance of brown spots, improvement in luminosity of the skin, improvement in, kind of the crepiness. So really all kinds of things depending on kind of what you need.
Got it. And I obviously coming from functional medicine, we talk a lot about bioavailability, like the ability of a nutrient to get into the cell, into the body, and do what it's supposed to do. And I'm assuming in the skincare, I know this from talking to different experts, dermatologists, et cetera, researchers on the show about skincare. The same thing applies, right? I mean, what we put on our skin, we want that to be absorbed, and the deliverability of that nutrient, whether it be exosomes or some other active ingredient, that deliverability matters. So is there with exosomes specifically, is that an issue, a hurdle that you all had to cross from a formulation standpoint to get the exosomes in the cell, or are the exosomes pretty bioavailable inherently?
Yeah, I mean, interesting question. I think the biggest challenge for us has been, it's a human derived ingredient. You're not putting plants or chemicals on your face. And it doesn't like a lot of other things that we put on our face, like sunscreens, certain pHs. And so I think the biggest learning for us that's evolving, I used to wipe my face with these makeup remover wipes and they had oil in them. So I was actually destroying the exosomes that I was putting on my face afterwards, thinking my face was clean. So I think that's been the biggest challenge. I mean, these are nanoparticles, like they know how to do their job. But I think the most important point is you have to start with clean skin and you have to wait and allow them to absorb so they can do their job. And you can't, immediately put sunscreen on or immediately put makeup on or layer other things. It needs a minute and it needs to always be first. And I think that's been for sure our biggest learning. And we're actually developing things that will ensure that, to make sure the pH of your skin is right, to make sure that you've removed
Mhm.
all the makeup remover or the sunscreen or whatever else you have on before you're applying that. And I think that's a bit of a change, right? We all have a routine. I'm like you, probably like fast, fast, fast. And it
Mhm.
seems like forever, but I'm also want the benefit. I mean, the skin is the largest organ in your body. You want the benefit, and it's important to do it the right way.
So the pro tip here to allow the exosomes to go and to repair, to provide the skin cells the proteins, the lipids, these metabolites, these beneficial growth factors, all these repair mechanisms. You want the skin to be clear, so washed, nothing else on it. I've had some dermatologists tell me, well, it's to put kind of a toner on first, or even water. So you don't want that. You want, before you even do that, just dry skin.
Yeah, water's fine. Water's absolutely fine.
Okay, like a damp
It's
skin.
a
Yeah.
water-based product, so we do have water in our product. I think it's, the pH, when you start using toners and things like that, sometimes it changes the pH of your skin, and you'd be surprised like how important, I think there's so much talk about microbiomes and things like that now, how important the, condition of your skin is to receive these, treatments that you're doing.
Got it. All right. I hear you, you're saying. So you want the pH to be as natural as
Yeah.
possible because it is human-derived exosome. So it's sort of like attracts like, I guess, in this way as far as the bioavailability. Okay, and that you brought up a really key distinction here that I think a lot of people, as far as the labels and understanding the marketing aspects, are going to be hearing more and more brands over the next couple of years. You all are leaders in this space of actually effective, evidence-based, human-derived exosomes. But you're going to see a lot of different brands as a consumer throw around the word exosomes, and sometimes what they're talking about, I find, is to be plant stem cells, and they're using these jargon, kind of, they're conflating terms maybe a bit. I'm not saying they're not beneficial, but it's hard to tell as a consumer they're not all the same. So what are your thoughts on these plant stem cells, or these exosomes that are really plant derived?
Well, you are correct. Exosomes is a big buzzword now. And,
Yeah.
we've created this industry and now we're getting all these people behind us. And
That's how
yeah,
that's how it works,
it's
right?
how
Being
it
a
works. It's
leader.
a great compliment. But you're right. Plant exosomes are not the same as human derived platelet exosomes, right? A plant cell cannot, as we talk about, communicate, like in a broad sense, with a human cell. It's not. There's been absolutely no published data on that. Now, can you get nutrients from a plant exosome? Absolutely. But it is not the same thing. It would be like eating a carrot. You're getting nutrients from the carrot, but it is not what we're talking about in terms of the benefits of a platelet-derived exosome that can have on your skin.
Yeah. Okay. So just to be clear, there's no published data on plant-derived exosomes when it comes to the benefit other than nutrients, but not the actual exosome function.
Correct. None that
Got it. Yeah, I haven't seen any either, but it looks good. And like you said, it's probably providing nutrition, which there's some benefit to it, but it's really not all, it's a buzzword more than anything else.
Absolutely.
Yeah. Yeah. And I think maybe this isn't a perfect analogy, but I think something came to mind when you mentioned carrots is if we're talking about bioavailability, a carrot, this isn't why you brought up that analogy, but it kind of works in this circumstance because the carrot has fiber. It has beta carotene, but it doesn't have the true retinol, right? And the body conversion from beta carotene to retinol, many people's conversion isn't great. So yes, you're getting retinol in small amounts and you're getting fiber and other things from the carrot. But to get the true retinol, you need to get it from something like organ meat. So it's a similar analogy to what you're talking about, right? It's like you actually want what your body can utilize if you really want the full benefits.
You're correct. Yes.
Yeah. Okay. So how much do you need? I mean, is it like if I have the exosomes, am I doing 1 pump, 2 pump? Like tell me how much do I need to get the benefits?
Well, just like your meditation or supplements, skincare really benefits from consistency. This isn't something you want to do once a week. It really should be a part of your daily ritual, like brushing your teeth. But if you think about it, it's really more for your skin's vitality. In our clinical studies, plated was used twice a day. So it just really depends on your need and where you are in your stage and how much, like for me, I was in the sun a lot. I'm an equestrian, I'm outside. So I use the product twice a day. Some people like to use it, once a day at night. They use the retinol at the other time. So this is why, you work with your provider and who you work with in terms of your aesthetic, kind of infrastructure and help them to work with you to say what's the best. But I mean, we have patients that are using it both twice a day, both, once a day.
Got it. And you have a hair serum as well. Can you kind of talk about that? I think people will be excited about exosomes and hair care as well.
Yeah. So we originally started all with skincare. And then we started really thinking about your hair health and scalp health and, wondering. And so we created a formula. And before we launched it or did any marketing, we actually did a very, almost pharmaceutical like study. So placebo controlled at a plastic surgeon's office. And we actually, had a whole arm that didn't have the product. And then after 6 months, they switched to the product. So we had some incredible data that was published in a peer-reviewed journal. And what we realized was that, these patients that are maybe postpartum, COVID issues, stress issues, that they were seeing
Yes.
thicker, fuller, less breaking, like all the things that you want. But I will tell you, with hair, you have to be patient. It's not an instant thing. It's not as fast as skincare. So our study went to 6 months because that's really that 4 to 6 time frame is really when you start seeing benefits. But the most interesting thing was we did these electron microscopy, I can't even talk today, photos, basically really tight photos
Yes.
of your scalp. And what we saw was this appearance of redness had really diminished over the course of using the product once a day. And the real trick to this is, like hair people, they want to just dump the whole bottle on, but you actually don't need that much. It's like a sponge. Your scalp can only absorb so much plated hair serum. And so you just need these tiny droplets once a day across the afflicted areas. And that's it, once a day. And you can put it on before you go out. It's not greasy. You won't have to worry for women that have dyed their hair. That it's going to impact the color. Just really, really simple. And, I was so excited when I saw those clinical results, and we waited to launch until then.
Amazing. So the two, well, let me back up a little bit. I didn't even kind of really tell people, but you mentioned plated. I love the name. Like, where did the name plated come from? Because that's how we're getting these human-derived exosomes.
Yeah, I think plated was really a nod to our source. A lot of the skincare, and I've worked in the industry for a long time, they in size 6 font, or if they even include it, they don't really tell you about the source, right? And we wanted to embrace it because we were so excited about the difference and how that we were leveraging this incredible source, and it was absolutely different from anything before. And then I think we also wanted to remind people that, if you think about, something's plated, it's protected, right? Something's gold
Yeah.
plated, it's been protected. Just that, nod to the idea that daily skincare is something that should be a part of your ritual and that you want to kind of renew your skin.
Yeah, I love it. Okay, so go into it's just the two main products that I'm aware of, the Intense and the hair, correct?
Yeah, so we have about 5 SKUs overall. So we've kind of grown. We have an
Okay.
eye serum. We realized eye was a very unique
Yeah.
need, especially for younger patients that have kind of those puffy eyes. They wake up. And then we do have a post-procedure product. So for in-office only, and that's really focused on if you're doing microneedling or a laser and you want this time to recovery to improve. None of us, we all want to look great, but we all want to get these procedures and they take forever to make you look like you didn't go to the doctor. And so we created that. So we've got several SKUs now and we're working on a bunch more.
Got it. So do you find in the research, do exosomes work best by themselves as an active ingredient, or are there other synergistic compounds, actives that you use within the different formulas? And if so, like, can you walk us through the other actives that work and to enhance the benefits of exosomes or work synergistically?
This is what's so different about plated skin science. If you look, most of our products have 12 to 14 ingredients, which is unheard of in skincare. Usually, right?
Yes.
It's like this big, it's in such a small font, you can't even read all of it. And it's probably not all included. So we don't need all those other actives. Do we have a few in something? Sure. In our hair serum, we have a few other things that, specific for hair. And our eye serum, we have specific things for the eye area. But in general, it is our renewosome exosomes, right? Like these are the things that are differentiated
Yeah.
technology, bar none. So we don't really need to add a bunch of things. And that's why most patients don't have issues. You have a lot of skincare that people can't use because it has this ingredient or that ingredient. We don't find that since we don't have so many that we have as patients that aren't able to tolerate it.
That's really great because from a telehealth functional medicine standpoint, we see a lot of people that do have sensitivities. I mean, they have skin sensitivities, they have digestive sensitivities, and you find that and this has been my experience with plated as well, is that it's very well tolerated. It's not something that people have to be worried about if they have sensitive skin. Is that what you're saying?
Yes. Yeah, it was designed for that. And when you don't have so many ingredients, there's not as many things to worry about.
The variables are less. Okay, so as far as like a category, without a doubt, the way that I see it is exosomes are like the new era of skincare. They are like basically what we're seeing is what it would have been like at the emergence of the retinol industry, only bigger, really. Is that how you see it? As sort of a category is concerned?
Absolutely. So retinol definitely had its moment, a long moment. But we really believe that these platelet-derived exosomes are the new gold standard in skincare. And we're seeing people adopt it as their primary, right? Okay, they do other things that they like, but this is kind of their main staple for every single day. It's the one thing you don't miss, right? And that's, if you actually look, we didn't make our bottles gigantic and put a tiny amount in and try to hide that. We actually made them very fit to purpose, right? What is in there is what you see. They're refillable. They're easy to take with you. So it's the one thing, no matter where you go, you always have your plated with you.
Got it. And it is, like you said, that it's only a handful of ingredients mainly. Really one of the only active ingredients are the exosomes because it is what is needed. And you're getting the therapeutic dose the research shows to be beneficial. So it's not like just slapped on a label and has tons of fillers, but it's like the 50th ingredient in it. You're getting that dose of exosomes that you need. Is that a fair way of saying it? So you would implement or integrate it into your skincare routine?
Yes. And I think it's very easy to implement because you can layer on top of it. It dries down very quickly. It's not tacky. There's no smell. It's cruelty free. It's clean, like all the things that you want to have as a part of your daily routine.
You mentioned it can have an antioxidant. It does have an antioxidant effect with these growth factors and metabolites that the exosomes are delivering to the skin. And you mentioned it may be able to replace something like vitamin C, another skin antioxidant. Do you find that it does simplify people's skincare routine where they don't have to use so many other products?
Yeah, most of our patients are able to simplify their skincare routine. So what we're seeing is they don't need the growth factor. Because if you think about it, growth factor is just one letter of the alphabet, right? The exosome is the full alphabet to your cells.
Oh, that's a good
And
way of
you
putting
know
it.
what I mean? And the growth factor is like the guy, it's like my kid, the kids that never turn the lights off and leave the lights on all the time. Growth factor is always on, right? And the exosome is more smart technology. They turn the lights off when they're done with their job. And so that's why we've seen people be able to simplify some of these things out of the routines, and maybe, maybe like I said, they'll continue certain things that they like. If they like a really heavy, like my mom loves a very heavy moisturizer in the winter. And this is not a heavy moisturizer, right? That's actually some things that exosomes don't like. But that's her routine. And so she puts the plate on first and then, her having moisturizer on 5 minutes later.
Got it. So that was a question that popped up in my mind is that you mentioned 5 minutes later. So if you're using it, dry skin, can be damp skin, you're using the exosomes first. How long do you have to wait before is 5 minutes okay? Or is it longer, better, or does it matter?
So in our clinical studies, 5 minutes is perfect. So you don't need to wait any longer than that. It's not going to be any different at 6 minutes or 7 minutes. And listen, if it's 4.5 minutes, it's not exact, but I think you want to, you're investing in your skincare. Again, your largest organ. And you want to give it the chance for vitality. And even though it's a bit of a pain, it goes fast. Like you just change your routine, right? I put it on, then I brush my teeth. And then, by that time it's like, oh, it's dry, it's ready.
Yeah, got it. And you mentioned a few weeks, I think you said a few months to really see the full benefits. What does the data show for people to start seeing visible changes in their improvements in their skin?
In our early trials, our first trial, patients saw results as early as 6 weeks, and that's when they see things like the luminosity of the skin, the appearance of redness, and then longer things, right? It takes longer in terms of wrinkles and dark spots and things like that. But yeah, our studies went out to 6 months, but you start kind of seeing that. And that's why you need to be consistent, using it every day and be patient. Like if someone promises something in one day or a week, it's probably not real, right? If it's too good to be true, it probably is too good to be true. Like things can't change that fast.
Yeah, well said. So I talked about retinol. We mentioned retinol. What is your take on retinol? I mean, do you feel like this ship has sailed? People really won't need retinol after exosomes, or does it complement it?
Yeah, I mean, I think it's a mixed bag out there. So some of our physicians are still using it, and others have walked away from it. So it really just depends on your skin and where you are in terms of, did you have a lot of damage? Did you have a lot of stressors in your life? How good were you when you were younger taking care of your skin with sun care? And kind of how much do you do lasers and other things? Like it's multimodality. So I don't think there's a one size fits all. I personally have stopped using retinoids. I was a redhead as a kid, so I just don't tolerate things very well. And so for me, this is just much easier, and I don't have to worry about redness or dryness or any of the things sometimes those give you.
Got it. All right. So you may be able to opt out of it because you are getting these renewal benefits that a retinol would have. And then on that same sort of note, like these chemical exfoliants, like the alpha and beta hydroxy acid, or do you find that people still should be using exfoliator, or are exosomes supporting normal exfoliation inherently?
So platelet-derived exosomes are going to hopefully increase your cell turnover, but it's really important that you're exfoliating once a week. The really critical thing, though, is unless you're using an enzymatic exfoliator, that exfoliator is not going to play well, likely, with your exosomes, right? So you need to make sure your face is completely clean. Like, again, I'm fast, and I got to make sure I still see
Yeah.
the clay mask over here. So we're actually developing some things that are going to be more exosome friendly in the future. But yeah, you want to exfoliate, and even your scalp. So if you're using our hair health, like it's important to exfoliate your scalp. You'd be surprised how much junk builds up there. So if you want to use the hair serum, it's great to have, some type of scalp exfoliant as well.
Okay, this is really good information. So we want not only to be clean face, obviously, and use the exosomes first, but getting that top layer of skin from a penetration and deliverability of the exosomes matters here. So you don't block it and it's just sitting on the top of the skin. You want to actually, for the exosomes to get into the cell. So it sounds like what you would definitely wouldn't want to do is put some sort of chemical exfoliation, beta alpha hydroxy acid, after the exosomes. Like you're not going to want to do that. You want to exfoliate, then wash your face, dry it, then put the exosomes. Is that fair to say?
Yeah, if that's how you do your exfoliation in the morning, absolutely. So you're going to want to wash your face, make sure everything's off of there for sure. Or you can do, if you do the exfoliation in the morning, you can exfoliate at night or vice versa. You just want to make sure you don't mix those ingredients. But once a week, like it's like your Sunday ritual for exfoliation or whatever day is great for you. I think that's really important.
Yeah. Okay. Got it. So yeah, if you do, I just know a lot of people, especially dermatologists, they'll recommend doing those overnight exfoliations at night. So if you're doing that, you're not going to want to put the exosomes on at that same time.
Absolutely not.
Okay. Got it. Any other pro tips that people should know about to get the most out of the exosomes as far as the research is concerned, or just anecdotally, things you've seen work the best?
I mean, I think don't forget your neck and your décolletage and your hands. I think those are ages, signs of aging. We forget a lot. We focus so much on our face. And I think the other, pro tip is just like we talked about is consistency. So daily use is really, really important. I think a lot of times you hear, oh, just, get one pump in the office. That's not really how your body works, right? It's constantly delivering these kind of renewing signals. And that's why this, every day is really important.
Okay. And then going back to something I didn't want to skip over it. You mentioned the hair exfoliation is really important, which probably a lot of people aren't thinking about. Maybe some women, but I think as a guy, I'm not thinking about exfoliating my scalp. I wash my hair, but I'm not thinking about exfoliating my scalp. Should I be? Am I so off base here? How I've been living like a Neanderthal all this time?
Listen, I think, finding the right product. If you're using the hair serum and you're trying to get things that are really, getting your scalp, you're going to want to make sure it's clean. And so, yeah, I think that's something that you could incorporate in once a week if you really want to have the best like hair and scalp health.
Okay. So going back to that clinical trial around the hair, I want to dial in because you mentioned that study, the double-blind placebo-controlled trial. You wanted to wait till that was out before you release this. What are the things that people are noticing with the consistent use over time of the hair exosomes?
So I think the first thing people always talk about is just thicker, like they parent a thicker, fuller hair. And this idea, you see a lot of shedding and a lot of breakage, and nothing's more frustrating when you're shedding, especially for a woman.
Hmm.
But I will say, like, if you have a shiny scalp, it's probably too late, right? So this is something you want to start early, especially for men that start seeing sort of the balding and, they have this genetic history. You want to get on top of it. And hair is multimodality, right? It's not just going to be this hair serum. There's other things that you probably should be doing as well to really make sure if you're nervous about kind of losing a lot of hair over time, you should be embracing other things, whether it's nutraceuticals, other things that your doctors are recommending, not just one thing.
Got it. And how any data looking at graying hair, asking for a friend because mine's a little bit on the side, and despite all living and breathing all the stuff, it's like I'm slowing it down, but not entirely reversing it. And any evidence for
Yeah.
help me out?
I know. I mean, listen, me too. I don't think that anyone has solved that completely yet. I think there's a lot of great work, even that we're doing on the biologic side, like the true, like of the different product. We're going to be looking at that. That will be more for an injectable hair restoration treatment. And so that will be something we measure, but those are FDA trials for an injectable biologic, very different than what we're talking about in cosmetics. But to me, that's a huge untapped market. Really just understanding what's happening there and what you can do. But you do see when people get PRP, you do hear reports. Now it's very inconsistent. So I think that's why we want to really study it and include it in our studies, as a secondary endpoint. There's a huge need.
Oh, there's a massive need. I mean, I will be your first customer here. So you're saying that clinical trials are being done to look at biologics like exosomes, or are they exosomes as it relates to injectables and what that can mean from if say hair recoloring grayed hair?
Yeah, so we have a different arm of our company, not the cosmetic arm for plated. We are studying what's called a purified exosome product PEP in biologic FDA investigational studies for hair restoration. So that is where it'll be injectable. And that is where we will look at those sorts of things. But we need to go through phase 2 and phase 3. I mean, there's a whole FDA process, as you're well aware of. But it's
Yeah.
very promising, the early things that we've seen. And I'm super excited about it because I don't think there's anything, people hate the hormones and they, the data now is just average, right? If even it's worse than average, right, for some of these treatments. And so I think there's going to be a big opportunity for us there. You just need to be patient. We're probably 3 to 5 years away from having that in the market. So you got to do your
Dang
topical
it.
hair serum now, and then we'll get you as soon as we're ready to get that.
Okay. Please tell the art of being well, family, first. But as soon as it's out, injectable exosomes on your scalp, I would be up for it. Okay, so you've been in the regenerative medicine, the aesthetics world for a long time. Like you've seen the underbelly of the industry. You mentioned kind of some things being a waste of time or money. Like, what do you think are some of the most biggest waste of people's time and money when it comes to the beauty world?
Oh, that's a great question. So, I think a lot of these topical products that you buy online, they're not in providers' offices, are often a waste of time and money. I think the aesthetic providers really make sure that they bring products in that have science and that have done clinical studies. And so that's the biggest thing I see. And I see all kinds of crazy claims. People send them to me every day of these products online. You don't even know where it's created. You don't know the history of it. You don't know, and especially these human-derived things. This manufacturing process is very complicated. You want to ensure there's no viruses, nothing transferring, right? We're running our entire program like it's a biologic. I mean, we're taking all the learnings from our
Wow.
sister company there. And a lot of these other companies are a little more, I worry, fly by night, and there's no FDA standards for what they need to be doing. So that's where I see number one, probably the biggest waste. Yeah.
Got it. So it is kind of the Wild West, especially with the jargon on the labels, and they could have put a small amount of something in and then claim it, and it's not really, it's not effective at the dose they're putting it in. It's like the microdosing something that shouldn't be microdosed. Okay, that's really fascinating. Anything specifically? Because what I see from the outside, I mean, coming from a functional medicine world, looking at the skincare world, it is a lot of, you're almost paying for the branding. You're paying for the prestige of the brand, not necessarily the effectiveness of the active ingredients. Is that an unfair judgment to put on in an industry?
That's 100% accurate for most things because they don't need the clinical studies. We're founding, our whole business is bio beauty. So again, we're running our studies like we're a pharmaceutical company. And that
Yes.
differentiated us completely. And yeah, and a lot of companies claim clinical studies. You'll see it on the website, and then you actually go to the size 9 font, and it's 8 patients. You know what I mean? Using microneedling and 10 other things, not just the skincare. So this is where you have to be really careful and do your homework because it does look, the 15-second reel on Instagram, it looks great, but you really got to dig in and understand.
Yeah. Any pro tips that you would give a consumer that is overwhelmed by that massive, whatever, online shop or walking down the Target aisle or the Sephora aisle? What works, what's worth their time and what's not?
Well, I'm a big AI girl, so I got to say, get on your chat GPT, ask which skincare have the most peer-reviewed publications, right, for the needs that you have. And again, rely on your provider, your physician, ask them good questions, understand kind of what is out there and what's been done in the studies. It's, these peer-reviewed publications are really key because you can't just do any study and get into them. And you want to see multiple, not just one or two.
Yeah, because the people, I mean, look, we're all consumers in this world. The algorithm gets people, right? I mean, they are influenced with the Instagram or the TikTok, whatever post. And it's just because it looks sexy online doesn't necessarily mean it's worth your time or money.
Yeah, and the other thing we're seeing is all kinds of diversion and fakes. And I mean, this is even comes from my days and working in other companies is, you got to be really careful because they put these amazing labels on and it looks like you're buying whatever you think you're buying. It's actually not. And so we've really done some very sophisticated things in our packaging. So I know, where my product's going. I know if someone's not selling it in the right place, who bought it originally. So I think you just have to be very careful where you're buying things. And
Yeah.
it's not out of date, right? A lot of times they sell things and they're out of date. which you don't want that either. So you just have to be careful.
Yeah, tell me if this is true or not, if you know this to be true, but I've heard from people, insiders in this sort of space, both in the skincare beauty space and the supplement space, actually, is that when people buy from third-party vendors on, let's say, places like Amazon, they're slapping like I think that's what you're kind of were saying, slapping labels on something that's not even it, or it's expired, or it's exposed to lots of heat and light, and it's not like a temperature controlled. There's no way of knowing when you're buying from these third-party vendors where they're even being stored or if it is what it says it is. Is that what you're talking about?
Absolutely. We just ordered a bunch of cleanser on Amazon and got it. It was all out of date for a clinical trial. So we're like, oh, we're not doing that ever again. And again, Amazon's doing a great job. I'm not trying to knock Amazon.
Yeah.
You just have to be careful. And it's hard for them to keep up. Even there was an article recently on Walmart. Walmart's got a third party site and they're having all kinds of problems with people taking fake name, like a real company name and pretending to be that company selling a product that isn't real. And this is
Wow.
a big deal because, who knows what's in those things, right? And so that's why buying it from, the direct site, trusted providers is important.
Right.
Expired things. You don't know where they've been frozen. These are things maybe someone wanted to dispose of and someone else bought it and resold it. You just don't know.
Right. Oh, that's fascinating to even hear it's happening at Walmart, where these sort of massive companies, they can't control everything. Right. And I'm certainly Amazon is doing great things, but how do they control everything? They don't know everything, especially if it's a third party vendor. So if you're going to use Amazon, go from a trusted company, a vendor within it, like go to the company itself that's maybe selling on Amazon. That's better. But again, I don't know about all the different warehouses, if the company's having to send to Amazon, if they're all up to snuff as far as the quality is concerned.
Yeah. And just like you said, the shipping, do you want your product in a warehouse in Texas at 110 in the summer for 6 months?
Yeah.
Maybe not. And so,
Yeah.
they're really solid vendors. They have temperature control. They ship in the right conditions. They don't ship when products freeze. There's just all those things that you really have to think about.
Yeah. Shipping logistics and warehouse logistics. Yeah, for sure. Okay. Any other waste of time or money, maybe even procedures you think that it's getting a lot of buzz, but maybe it's not worth it for people?
So in terms of like aesthetic procedures?
Yeah. Yeah.
Yeah, that's hard. Yeah, I mean, I think, okay, listen, what we're seeing the trend is people are doing less dermal fillers, right? They're moving to more regenerative treatments. And I worked in the dermal filler space on both of the two big brands for a long time. And so I still believe they have a place, but I do think like everything's moving more towards regenerative things. That's what people want, right? We want to use the power of the body, to heal. And science has finally caught up there. And I think we're just going to start seeing more and more products. But the problem right now is that there are no FDA consensus on these things. Like think about, we've had stem cells for 20 years. Name one FDA approved stem cell therapy. None, right? Nothing got approved because there's no consensus. And so we're really working with the FDA and trying to get through so we can have consensus and understand what these therapies need to be. Because, I mean, if you go in now, there's people injecting exosomes, like absolutely, positively do not get exosomes injected, right? There is no FDA treatment that is approved. And I'm telling you, there are all kinds of issues with viruses and screening and the sourcing. You just do not want to do it. So if your provider is offering that, like I would be very reluctant to get that. I think in a few years, we'll get it through. We'll ensure it's consistent. We'll ensure it's safe. But that's the one thing people I feel are wasting their money on now. Is just, and I was in Miami yesterday and it's flashing big sign like exosomes injectable. I wanted to drive up and be like, where's the FDA approval to be doing this? But it's hard for the FDA to keep up with this stuff.
Okay, so we're getting in the weeds here because that's a very interesting perspective, and I think good for us to talk about. So I am hopeful, right? I am hopeful because I know Dr. Marty Makary at the FDA now wants a lot of these things that had a lot of red tape. Like you're saying, this is not new per se, but it's been stifled and kind of kept back from the democratization, the accessibility of it, and kind of advancing the science of it, right? Are you hopeful that maybe this new HHS, the people, at least some of them within HHS, want things like exosomes to get more science, get more data so it can trickle down to the market?
Yeah, I mean, I think even the old leadership with Peter Marks wanted this to come through. So I think there's consistency in the FDA. They just want to do it the right way. They want to have consensus guidelines. They want to be sure that it's virus free. Just all the things before we, send it out to the masses. Because I think what you're going to see is when this finally is available, it's going to be revolutionary. So, I mean,
Yeah.
it's going to change. And so we want to make sure when we offer it, it's ready for the masses.
So it's been around 20 years. The science has been around for 20 years, you said?
So stem cells have been around for 20 years. So exosomes, I think we're really, in the past like 10 years in terms
Yeah,
of kind of
5 to 10 years.
discovery. So we have a parent company called Rion Inc. That, our founders are working on medical things. So they're working on diabetic foot ulcers. They're working on, knee osteoarthritis, I call them true noble causes, right? And I think that's what you're going to
Yeah.
see in the future is, these treatments will get through the FDA and be available to us.
Yeah, because okay, so if stem cells have been on in the research for 20 plus years, what is the delay with the FDA? I mean, you mentioned the last FDA director, whoever the last people were before that. I mean, what is taking so long when we see such exciting data?
So I think what's happening is these therapies aren't as consistent as we think they are, right? So as the FDA looks at the data, it's not approvable. And that's the last thing we want is to rush something through and then realize that we have safety issues or we've got, it's not consistent and all these people go and get it. And then we figure out later, oh, that wasn't so good. So they just, stem cells in general, they just haven't been able to kind of make it consistent enough. So every single dose you get is the exact same in a cost that's effective, right? I mean, you probably could do that for $5 million, but you can't do that democratizing regenerative medicine across stem
Mm-hmm.
cells. And so that's why I think really it's shifting. The discovery's been it's not stem cells, it's going to be exosomes in the future.
Yeah. Well said. Well said. And it is interesting though, because I feel like some things, and again, I'm not in government. I don't understand the ins and outs of all of that sort of FDA approval, but it seems like some things get kind of a fast pass. Like pharmaceuticals tend to kind of can go through quite quickly when there isn't maybe always the best data. There's some good data, but it's a mixed bag, but it's on the market. But I feel like things like exosomes, even if it's a mixed bag with stem cells, for example, you would think like the benefits versus the potential drawbacks. I don't know. Do you agree or disagree with that?
Yeah, I mean, I think I think we've seen things that we wanted to be expedited that weren't. We don't. You and I don't know the behind the scenes. Like I've worked in
Yeah,
pharmaceuticals, and you see some of the data, and you're like, oh, like maybe that shouldn't be expedited, and we aren't seeing all
exactly.
the stuff. But then you also see these, very small diseases, orphan drug diseases that they try to expedite because there's so few people, no one wants to study them, and because they can't,
Yeah, yeah.
they can't make bazillions of dollars studying something that 10 people have. And so, those are the ones you really want to see kind of moving front and kind of taking risks on. And I am very hopeful that I think there's going to be a future where those things will move forward in a way that we can get therapies out faster.
But I do think you brought up a good point of these potential the virus aspect of it, sort of the immunomodulating variables that may not be always great. And it is, some people are reporting benefits going to Mexico or going to another country and getting these stem cells therapies. And then some people can have horrible spinal infections. I know two very prominent colleagues of mine within the functional medicine world that both got spinal infections from these injections, these stem cell injections in other countries. Again, they still are advocates for them and they would go do them again, but it does come with a risk factor. And is that what you're talking about of these, the sort of immunomodulating pathogenic aspect of what could be irritating to the immune system with these stem cell injections?
Yeah, that and all the other stuff we might not even know about yet. Because what happens is when you do a
Yeah.
clinical trial, you only have 500 or 600 people, and then you go to the masses and you have 30,000, and you don't see it amplified till it gets to the masses. And that's why, having pharmaceutical companies be able to do these bigger trials and understanding things and moving faster, allows us to get that data before it goes out to everyone. But yeah, I mean, I've definitely heard of a lot of cases where you go to Panama and you come back and you have all kinds of issues. And, me personally, I wouldn't do that. I want to wait and get, the approved treatment. And listen, if you're really in need, you get involved in the clinical trials. Like there's so much opportunity to get involved in clinical trials for phase 2 and phase 3. So, do your homework and get involved in those trials. Like we have, phase 1 studies for knee osteoarthritis, you have heart attack. Like there's opportunities to get these treatments in the clinical trial setting now.
Oh, well, that's such great news. So, how would people find out? Like, how could they find out more if they're a good candidate for these clinical trials that are being done in a safer way?
Yeah, so I think that's first through your provider, right? Through the institutions that you trust. A lot of these big institutions. So, HSS is a big orthopedic institution. Rush is a big orthopedic institution. So we're just talking about orthopedics, right? You go there and you have sites. They say, hey, this is our clinical trial program, and you can see, are they offering programs? You probably can use AI now to search the whole, US to see what clinical problems or clinical trials are going on for your particular ailment. But I think those are great opportunities. Now, you might not always qualify because the criteria is usually very strict, but if you do and it seems interesting and the risk and benefit is the right thing for you with your provider, I think it's a really interesting option.
Yeah, thank you. Okay, so going back, maybe because you're such an expert in the skincare regenerative space, what are other things that are worth people's time or money? Are there other things that you feel like are non-negotiables for you in addition to exosomes?
Yeah, that's a great question. So I love lasers. Full disclosure, I'm on the Cyton board, which is a laser company, but I did that because I love kind of the idea of doing laser treatment to the skin. I think there are things that the lasers do that are wonderful, especially, I think about my aging spots, I think about some of the other, problems areas that I have. And so I really have a very regular routine when I go in and get laser work. I still do my toxin. I'm a believer. I don't think you need to go crazy with it, but I actually am a believer in that because I do believe that movement over time does impact some of those deep wrinkles, and you can do a little prevention there. Um,
Yeah.
I also think, facials, and I'm a big like wellness, like you are, right? Like massage, all those things are good. If skin is your biggest organ, so doing all those things is good for your lymphatic drainage. Like it helps everywhere, not just your face. Um, and so I'm a big believer in those things. And I have a routine in terms of, my like daily skincare and cleansing and things like that. But I'm kind of a simple girl. I don't do a lot of stuff. Sunscreen all day long. But I will tell you, my hack is I buy all my sunscreen in Europe because there's 3 ingredients that are not approved in the US. So I'm the crazy girl that I don't check my luggage because I'm worried about my clothes. I check my luggage because I bought so much sunscreen when I'm in Europe.
All right, this is great. We have to unpack a few things here. So, pro tip, only buy European sunscreen. Are we talking about any European sunscreen? What's your favorite European sunscreen brand?
So I like a few, La Roche-Posay, Vichy. So you have to go and, go to the pharmacy. You can't just get anything. And if you Google, like, what are the 3 ingredients not approved by the FDA for sunscreen, like you can find what products they are. There's a Daylong that I think Elderma makes that's, a more average price skincare. But I find they last longer. I'm outside all the time with horses and I don't want to reapply every 2 hours. I find that these are much better. And I do like a little bit of a tint so my face isn't white with sunscreen. That look you used to have when your neck.
Yeah, zinc oxide. Yeah.
Yeah, yeah, exactly.
So what is it what like why can't we get these sunscreens in the United States? Why only in Europe?
That is a question I cannot answer. The FDA has not approved them. It's something, and again, I don't work in sun care, so I don't know, but I know there have been a lot of efforts trying to bring them over. But I feel like, EU is very careful about the things that they approve, especially in skincare. And
Yes.
this has been a long time. So, that's why, I go,
Yes.
I'm the girl at the pharmacy at the airport that I'm like cleaning the shelf off.
That's amazing. And you'd think, yeah, like because the EU takes, like you said, such a precautionary, conservative a take approach when it comes to these active ingredients that we definitely should be. Come on, FDA, let's get on it. You mentioned cleanser being a simple girl. Like, what's your favorite cleanser?
Well, I actually have one that we've made, so I can't talk about it yet, but I love that.
Oh, well, give us the tea, Alyssa. What's
It's not ready yet. When it's ready, I'll let you know. It's exosome friendly. So I will tell you that, again, because I'm quick and I wasn't cleaning my face off. I actually had our formulator develop something that was exosome friendly. So that way, if I'm going quick and I still have something on, it's not going to impact and destroy the exosomes.
amazing? So, do we have like a timeline when it will be out, roughly, or?
Probably next year sometime. So yeah, we want to
Okay,
make sure
all
we
right,
really
all
get
right.
to things and get it right, and before we put the plated
I
name
love
on
it.
it.
I love it. So you're still working on some things, but stay tuned. You have to come back whenever the cleanser comes out.
I would come back. Yeah.
Um,
Yeah. So we're working on,
yeah.
a lot of other options as well. Like there's just so much we can do now. This is a platform technology. And in fact, we get so many ideas, lips and body and nails. And, we want to do it right and study all of it. So we just are kind of taking it one by one. Right now, we're working on an eyebrow study. So actually using the hair serum. And I think it's post-menopausal women and postpartum women with hair concerns. And then they're also applying it to the eyebrow. So I'm really excited to see how that data comes back.
Very cool. You mentioned being a massive fan of lasers. There's a lot of aesthetic lasers on the market. Like, what are the top ones that you think are worth people looking into?
Yeah, so I think BBL and Halo are two great. And again, the laser really depends on your needs, right? Because I have brown spots, and you want to get some of the other benefits. I may not have those things, so it depends on your skin type. So again, this is where you really can partner with your aesthetic provider. But I do a very ablative laser, once every couple of years. I think that's really, really important. My skin looks beautiful after it. In fact, yesterday I was just in the dermatologist. So you can probably see got a few laser zaps on my skin today. But yeah, I think it's important to stay on top of it. And I think your skin just looks so much healthier.
Yeah. And you mentioned movement over time. As far as an aesthetic standpoint, minimally invasive procedure, you are a fan of Botox. And people ask me a lot, okay, it's a toxin. What's your take on it? Like, I deal with a telehealth patient base that's very sensitive. I don't see problems with it. For people who get it over time. I know some people have it. There is an inherent potential risk, but it's rather small from what I have seen, especially when I take in consideration the population of people that I spend my time the most with clinically. What's your take on that?
Yeah, so I worked at Allergan, I worked at Galderma, so I worked on Dysport, I worked on Botox. Toxin in general is very well studied. I mean, there's all these people that also get it on the medical side for cervical dystonia, migraines.
Migraines.
My
Yeah.
mom has blepharospasm, so she's getting it for that. And so, these are medical that they're using it. And the market's almost as big as it is on the cosmetic side. So I think it's a very well studied in the right hands, right? I see all this craziness of people injecting. They don't have a license. They don't have a medical person underneath them, right? You got to go to someone. You can't just like go to
That's
the pub
reputable.
to get these things. You have to go to someone reputable because this is serious. Like this is a medical procedure. And I think people forget that. And the importance of seeing like a qualified, well-trained provider, not someone that does this once a week at, some fly-by-night organization.
Yeah. And I've had different plastic surgeons and skincare experts on the podcast, and they each have their own opinion on, does it even matter? But like the Botox, the Dysport, the Xeomin, I think, and like Xeomin apparently has less preservatives and fillers, excipients. Like, do you have an opinion on that of the clean aspect of it, but also, I guess, the effectiveness of it if you're going to get it done?
Yeah. So for me, again, I don't like going to the office. I'm busy. So I like things that last longer. And I don't believe so much that clean aspect. I want something that's going to look natural. That's the number one most important. Be safe and last as long as possible. And so the two brands that I use are Dysport and Botox.
Got it. Got it. Anything else, like from a active ingredient that you think people should implement into their skincare that works alongside exosomes?
Yeah, I mean, nothing. I mean, really, it's if you're using platelet-derived exosomes, like I don't think that there's something you have to. I think it's more things that you like, and it goes well with kind of your lifestyle. But the number one thing is sunscreen, sunscreen, sunscreen. That is the biggest thing. You cannot have enough sunscreen. There's a great picture we have of a woman who was a truck driver, and so she got sun on the left side of her face from all the driving, and the difference in her wrinkles from the left side to the right side is incredible. It's profound. And so I think we
Wow.
forget. And then, the other things too is you forget you're walking. I walk the dogs a lot, and so my hands are getting so much sun. So you've got to remember to your neck and your hands and apply as much as you can possibly.
Yeah, a clean formula, obviously, and a specific SPF that you like, that you think is the most appropriate, or is it based on your skin tone?
I mean, I think for me, I buy, 50 in Europe. Like I said, I don't know, going up to 70. I don't know if it really matters. Um,
Yeah,
I think if you're
right.
really sensitive and you've had, like I have both my parents have had melanoma. So I need a chemical and unfortunately I need a physical, I need both. right? I can't just use a physical blocker because the risk of melanoma is so much higher than probably the chemicals I'm getting from the sunscreen, that I use both of them. And I will tell you, one of my hacks, I have it here, is a color science brush that I use. It's a 50 and it's a powder, and it's super easy to put on when you're outside and you're sweaty and you don't want to put more sticky sunscreen on. I love that. I bring it everywhere. I always joke with the CEO of Color Science that it goes with me with my plated everywhere.
I love it. All right, my friend, no, actually, before we go, I want to do the podcast is called The Art of Being Well, obviously. At the end, we have Your Art of Being Well. So first question is, what's the most disgusting healthy food that you eat? You do it for the benefits, not the taste.
Oh, the most disgusting healthy food. Oh, that's a great question. Let me think about that a little bit. I have a lot of disgusting things. Um, hmm. You know what I would say is, like, as a child, I hated Brussels sprouts. I mean, I wouldn't eat them if they were anywhere near my table. And now I try to eat them a lot, but not in bacon and butter, like more plain. And I have to say, like, they don't taste that great without all that butter and bacon and things like that.
Yeah.
But I do try to eat them a lot.
Yeah. You need to bake them with, bacon for sure, some cranberries, something like that, maple syrup.
They're very bitter, right?
Yeah.
Yeah.
Yeah. I love Brussels sprouts, but done properly.
Yeah.
Done for the human, not the rabbit.
Yeah, exactly. Exactly. Yeah.
What do you take supplements? And if so, maybe what are two lesser known supplements that people should know about?
Yeah, so I do take supplements, not a lot. I think the biggest, hottest thing is gut health. We forget about that, right? We're doing all these other things, and I think you're going to really hear a lot more about gut health coming up, and just the importance of what you're doing there, because it is so critical. And so that's definitely something that I implement daily. But I'm not crazy. Like, I don't take a lot of things. Again, I think this is from my pharmaceutical days, where, like, there's not a lot of studies. So I'm very careful. You don't want to have too much, right? Like, some of these longevity things are great, but maybe it's not every day, right? Maybe they're pulsed. So.
Yeah, I agree. For most people, especially from a maintenance standpoint, we should start with food and fill in the gaps with targeted supplements where needed that do have good data behind it. For gut health, is it a probiotic? Like, what do you take specifically to support gut health?
Yeah, fiber and probiotic. So, and actually,
Great.
I was just, at a conference, and I sat next to a CEO that was working on a new product. She gave me some samples of her products. So I'll let you know if I like that one as well.
Okay, let me know.
Like, I think, right, just doing something is important, right? Both probiotic and some sort of fiber. If you don't eat enough fiber, I don't eat enough fiber, so I try to supplement there.
Yeah, like a psyllium husk or inulin fiber. Do you have a favorite type of fiber that you add in?
No, I don't really. I'm not that picky about a certain one. No.
Okay, got it. What's the weirdest, most out of the box thing you've done for wellness that you're willing to admit on a podcast? You didn't know I'd be asking you these questions, Alyssa, but.
Oh, the weirdest thing I've done for wellness. Oh, I don't know. I don't know if I've done anything like super strange. I'm sort of conservative.
You're from the pharmaceutical world, so maybe not so much.
Yeah. Like, I'm slow to adopt. I don't do crazy things. You know what I mean? Like, okay, I have a subscription to, a monthly thing where I can go and do all the, red lights and those sorts of things, and the compression, but none of that's like crazy, right? It's all pretty well studied. I wait to make sure that it's, well studied.
Hey,
I think I've seen so many bad things happen to people and so many adverse event reports that I don't want to be on that. And so I think that's why I go a little slower.
Hey, I love it. There's something to be learned there. I think people should take a measured approach. I do think that wellness kind of overcorrects sometimes, and people like add more things in just for the sake of it. That may be fine. It may not be harmful, but it's like, is it going to be a needle mover for you? And I think that's not just the safety of it, but the effectiveness of it is certainly a valid point that you make.
Yeah, no. And I think there's like, people are overdoing it, right? Like, you don't need so much, rapamycin age 30. I'm not sure that that's like proven. You know what I mean?
Yeah, maybe not. Every person should be looking into that. All right, my friend, where do people go to learn more about Plated? Tell them where they should head.
Yeah. Well, first of all, any aesthetic provider that's carrying plated or on the Plated Skin Science website.
Amazing. And you can follow Plated at Plated Skin Science on Instagram, or it's platedskinscience.com, correct? That's
Yeah.
the website.
Yeah. You got
Alyssa,
it
thanks
right.
for coming on.
Thank you for having me. Very interesting.